In this presentation, Dr. Bowen will discuss proper goat management, healthcare, and various diseases and other issues goat producers encounter. Dr. Bowen is a practicing veterinarian who provides on-farm services to goat owners in Colorado. She served as president of the American Association of Small Ruminant Practitioners from 2011 to 2013, as well as being active in other organizations. The American Goat Federation, AGF, was organized as a non-profit national association in 2010 to represent the interests of all organizations and producers engaged in the production and marketing of goat milk, meat, fiber, pack goat, and grazing services across the United States.
Okay. So we're going to talk about health concerns for goat producers. And when they called and asked if I would speak this afternoon, they said, well, you know, there'll be all sorts of people in the room, but we guess they're going to probably mostly be meat producers. So what do people do? Do we have any dairy producers here? Nobody's raising their hands. You guys are got to be proud of your profession. How about meat goats? Do we have boars, Kikos, fainting goats, Tennessee peg-leg goats? Anybody with fiber goats, Angoras, Cashmere? Nope? Okay. So, well, I hope I will touch on topics that will apply to all of you. I've been a goat veterinarian now for about 40 years. I've been actively involved with the American Association of Small Ruminant Practitioners for probably the last 20 years. And one of the goals of the American Association of Small Ruminant Practitioners is to provide continuing education for both producers and veterinarians, because the average veterinary student graduating today can make it all the way through college without ever seeing a small ruminant. They may not have contact with a small ruminant faculty member. So a goal of our association is to provide as much education as possible, and we think if we provide education to producers as well, we're educating a clientele that will then work more cooperatively with veterinarians. So I was trying to think of what the challenges are that are facing goat operations and that would cross some of our different uses of goats. So in the interest of being topical and current, we're going to talk a little bit about the things I really want you to know about: the Veterinary Feed Directive, the veterinary client-patient relationship, the changes in drug availability that went in on January 1st, why you might want to establish a federal veterinary client-patient relationship, some of the things about internal and external parasites, and you might be surprised at a few of my comments. If nothing else, please go home remembering that all nutrition is local. Though it's somebody feeds in the south of Texas is not going to be the same thing that a person in Wisconsin, Colorado, or California might feed. And just because somebody feeds it successfully somewhere else does not mean you can feed it successfully on your own operation. We're going to touch on body condition scoring. It's something I think we don't do enough of. We're going to talk about testing for chronic infectious diseases, routine management practices that should improve your productivity, and just one and only one slide on genetic selection. Why do we care about the Veterinary Feed Directive? How many people in here have you ever used a VFD? I know there's at least one person. And are you aware that the Veterinary Feed Directive says that you can't use it in an extra label use? Anybody aware of that? So the Veterinary Feed Directive is part of a last 4-year effort by the government to try and decrease the incidence of antimicrobial resistance. We have had pretty much willy-nilly feed whatever you want antibiotic use for the last 60, 70 years. And there are those who believe it contributes to the development of antimicrobial resistance for antimicrobials that might be used of human concern. So we are banned by federal law from using cephalosporins in an extra label manner in a food animal. We can't use fluoroquinolones in food animals with the exception of labeled doses for Baytril. And other than that, the government is trying to cut back on our food production use of antimicrobials in hopes that we can save antimicrobials for human use. So the VFD came about. It was first announced to us in 2013 that they were going to revise it. And it defines the use of medically important antimicrobials that would be administered either in food or water to food-producing animals. And regardless of why you might keep your own personal herd of goats, they are considered by federal law to be food animals. So even somebody's pet pygmy in their backyard, by federal definition, has to use medication appropriate for a food animal. The idea was to eliminate the use of antimicrobials for production purposes, for feed efficiency, or for rate of gain. And so animals entering the feedlot, one might still be able to use antimicrobials if you had an outbreak of pneumonia, or particularly in lambs or goats going into intensive operations. They worry about pneumonia on entrance. Sometimes they're worried about enteritis, diarrhea. So those might be purposes where it would still be acceptable, but you cannot use antimicrobials in feed just for feed efficiency or to improve the rate of gain. They can only be administered in feed for the purposes of treatment, prevention, or disease control. The use of antimicrobials in feed has to be targeted, it has to be limited, and they cannot be fed continuously. And the other thing that's important about the Veterinary Feed Directive that actually changed 2 years ago, and it kind of went under the wire for most people, is that veterinary oversight is now required for a VFD. So if you want to use antimicrobials in feed or water for your livestock, you will have to involve a veterinarian. What that means is that we have to establish federal VCPRs. If you look in the federal documents, there's a definition for the veterinary client-patient relationship that lists specific things. And you say, well, I live in Texas, I only have to meet Texas's requirement. Or I live in the District of Columbia, if there's a food animal in the District of Columbia, and I only have to meet their requirements. Under the revised VFD, anyone using antimicrobials in food for food-producing species must meet the federal definition. And there's 22 states that do not, their state VCPR does not meet the federal definition. There's a website available online that if you wanted to look up your state, most of them are in the south or on the east. Most of the western states meet the federal definition. But what does it mean? What is the veterinary client-patient relationship and why should you care? Basically, it determines how the animals are going to be handled and how they're going to be treated. To meet the federal VCPR, your veterinarian actually has to have visited your premise. They have to be licensed in the state in which the animals reside. So say, for example, if your favorite veterinarian you like to talk to lives in Kentucky, they cannot write you a VCPR for Colorado unless they're, a veterinary feed directive for Colorado unless they're licensed in the state of Colorado. The veterinarian has to assume the responsibility for clinical judgment and diagnosis, and the client's going to agree that they will follow the veterinarian's recommendations. Every time I see that, it makes me smile because I always wonder when I'm working with my clients, are they really going to pay attention to what I tell them, or are they going to do what they want to do anyway? But that's part of the VCPR. So the veterinarian has to visit the premise, they have to examine the animals in question, they have to be aware of the health management practices. What do they feed? How often do they feed it? How do they water their animals? Where are they housed? All those things are part of the VCPR. And, from my perspective, the veterinarian has to be available for follow-up care. So if I'm flying out of town next Monday, I have to make sure that either people can get a hold of me by phone, by text, by email, or I have provided them with a veterinary contact that they can follow up with. Why should you establish a VCPR? Well, it's a good idea because it's the only way that you can use federal guidelines to use antimicrobials in feed for food-producing animals. Probably the most common use of antimicrobials in feed for our sheep and goats would be in the use of, if you have an outbreak of an abortion storm, thinking of the range sheep in the western U.S., and you want to treat it with tetracycline in feed, as in aureomycin crumbles, now the only way you can do that is if you have a VCPR, and it has to meet the federal standards. When they first came out with the new revised Veterinary Feed Directive in June of 2015, they first told us that there would be no extra label use allowed. And those of you who've been working with sheep and goats for years know that there are very few antibiotics available to us legally to begin with, and that most of them we're using with a veterinarian's help in an extra label manner. So the American Association of Small Ruminant Practitioners appealed to FDA to come up with some way to allow veterinary oversight to allow for the use of extra label use. And so on December 2nd of last year, December 2nd, 2016, the FDA revised the Compliance Policy Guide 615.115, which allows the FDA to have discretion in whether or not they enforce the regulations about extra label use. So a veterinarian can order the use of medicated feed for a minor species if that feed is approved for a major species, i.e. cattle, swine, poultry, and can be used to treat an outbreak to prevent loss or suffering. Only veterinarians have the authority to authorize drugs to be used in a manner different from the label, and this is not something where a producer can go to a feed mill and say, geez, I've got an abortion storm going in my goats, they've got chlamydia, we've diagnosed chlamydia. The only way they'll be able to get drugs to treat those animals in feed would be working with their veterinarian under a VCPR. Something else that we've discovered with the changes that they've made, and again, their goal is to decrease the unnecessary use of antimicrobials, is they've changed the way some drugs are now available to producers. So drugs that used to be available over the counter in feed are transitioning to VFD. And so this would include chlortetracycline, neomycin, oxytet, and oxytetracycline neomycin. Some of you might say, well, I don't use those. But chlortetracycline is commonly used as aureomycin crumbles. It's been the traditional way if you had a large either herd of goats or flock of sheep and you needed to administer antimicrobials in feed, you just go down to the feed store, pick up a 50-pound bag or maybe 2 tons if you have a large herd, and put it and top dress it to the animals. That's no longer a possibility because feed stores can no longer do that. They now have to have a VFD in order for you to be able to buy a product, even if it's just being top dressed. There used to be water-soluble products available over the counter. Some of you here may have purchased either chlortetracycline that could be diluted in water. Neomix was commonly available as a liquid that you could put in water. Oxytetracycline, spectinomycin. Anybody here use the spectinomycin pig pump in young animals? Guy in the back. It's now back behind the counter and you have to have a prescription for it. Sulfadimethoxine, many of my clients use sulfadimethoxine in their coccidiosis prevention program. It's very efficacious, but now it has to have a prescription from a veterinarian. So water-soluble drugs now come under prescription. Your veterinarian can fill that prescription or they can write you a prescription to a farm store to be able to access those products. The cool thing about this, if there is one, is that ADGA governs prescriptions and not VFDs. So it is much easier for me to interact with my client, diagnose their problem, write them a prescription, they can pick up the product wherever they want, versus writing a veterinary feed directive. If I write a VFD, it's got 3 copies. 1 copy that I keep permanently in my records, 1 copy that I give you, and 1 copy that I deliver to the feed mill that then is allowed to mix that feed for you. ADGA gives me a lot of leeway and a lot of leverage in how I might use drugs as long as I'm very careful to determine a withdrawal time so that we can make sure that any products used for human consumption from those animals won't have violative residues. So there's sometimes advantages for using water-soluble drugs versus using those that are over the counter and would go in feed. We're going to switch gears here. I told you we're going to go through like 10 topics over the time. This picture is to remind myself to tell you we're switching to parasites. How many of you have a routine deworming program for your herds? One guy in the back. It is very common for people to get into a stream of, well, my does are going to start kidding in April, so I'm going to deworm them in March. The grass is going to come up in May, I'll deworm them in May. And they get on this routine of, I'm going to use these drugs every certain interval of time. And the thing that if you remember nothing else today, please remember that not all goats suffer parasitism, that our environment makes a dramatic difference, our management practices that we choose impact it. On the left, we have some red boars from Australia. I believe that people here are calling them Kalahari Reds. Out there, they just call them red boars. And they're kind of taking over the boar industry, the meat industry in Australia, because they're really hardy. But you'll notice those animals are in the dry environment in Queensland. And then on the right, we have a really nice Angora ewe from down in New South Wales in southern Australia. And all we've done is we've moved 1,000 miles south. So she's kind of like being in the southern U.S. with lots of water, lots of fresh green grass. She's going to have much greater chance of exposure and therefore at greater risk for parasitism than those red Kalaharis on the left that are up in the dry lands. So it's important before we start treating animals to make sure that we understand that there are many causes of anemia in goats, that not all goats have parasites, and parasites are not our only health concern. And this may sound kind of funny to you, but I'm on the ASRP listserv almost, probably 4 or 5 times a day answering questions from people, and the most common questions by far over the course of the year will be having to do with parasitism. And yet when you look at the whole of the United States, parasitism is not important in every single area. I'd like to discourage you from deworming on a routine schedule. I'd like to encourage you instead to either use the FAMACHA scorecards, which you see, and yes, I do realize that's a U, and after I was looking for a picture of a FAMACHA card, I realized that every single picture I have is using them with sheep and not with goats, so I'm going to have to rectify that. But anybody here use FAMACHA scoring? Have you heard of it before? So FAMACHA scoring is a way of how anemic is this animal? And deciding, is this animal anemic enough? Is it affected by parasites enough that I need to deworm it? And what should I do with it? And the gentleman, when I was listening this morning, was commenting about selecting animals for resistance to disease. Well, there is documented evidence that you can select goats for parasite resistance, in addition to having good management practices, in addition to keeping feet up off the ground or moving grazing animals so they are not standing around on their feces, having clean water sources. You can select for genetic resistance. The other thing there is a McMaster slide. It's really important to routinely go through animals on a set basis, depending on the climate you live in, for FAMACHA scoring to register your level on an individual basis of what their level of anemia is, and then fecal ag counts should be done prior to treating the goats. And the idea of that is you are not going to know if your treatment was successful and solved your problem unless you know where you were to begin with. So the idea is to test the individual animal to begin with, and I'm not saying test a herd of 1,000 goats. Pick out the animals who are anemic, find out what their egg counts are, and then 2 weeks after you treat them, go back and test them again. You want to weigh animals before you deworm them. And for a lot of us who have small herds, an easy way to do that is with a weight tape. Dr. Mary Smith is the author of Goat Medicine and is on faculty at Cornell. She carries a scale in her ambulatory truck. And if the owner has a scale and she provides a scale, you put 2 feet on the front scale, 2 feet on the back scale, and you've got the weight of the animal. It gets you in the ballpark of how much those animals weigh. So maybe you've got a pen of 150 kids, you've got a pen of 100 yearlings. You can pick out the animals you're most concerned about, weigh them, and get a ballpark for treating that age group. You want to choose your Anthelmintics carefully. People want to reach for the newest, most recent Anthelmintic, and oh my heavens, it'll work well. And quite often what we find is because of overuse, the animals, if you live in an area that has heavily parasitized, we'll find that in those situations that Anthelmintic may not be the best choice. It may not actually kill the parasites. We're finding today that in areas that heavily deworm their animals, sometimes we have to use 2 antiparasiticides at the same time, or we might use some of the old-fashioned ones. I noticed that there was mention this morning about using levamisole as an immune stimulant. I want to discourage you for using levamisole for anything other than necessary anthelmintic use, because it's been long enough since we were using it heavily that many of our parasites are not resistant to levamisole, so it's a good one to use when you're dealing with parasite resistance. If you treat them, you want to check their fecal egg counts 2 weeks later. You want to improve the management practices. How did you get into a problem to begin with? If you have animals on rotating pastures, did you leave them on too long? Goats really don't like to graze off the bottom of the ground. They want to take the tips and move on. And when you think about fecal eggs falling down to the bottom of the ground, if you can keep them grazing off the top and move them before they've grazed the grass to the ground, you can decrease parasitism that way. And you want to, like I mentioned, you want to select for natural parasite resistance. The other thing that we don't often talk about is Coccidia. Coccidia are small, one-celled obligate protozoal parasites that live in the digestive tract. And I want you to realize that all adult goats and all adult sheep carry Coccidia in their digestive tract every day. And the species of Coccidia are usually species-specific until you get into sheep and goats. And then they share the same species of Coccidia. Some of them cause more serious disease in sheep. Some of them cause more serious disease in goats, but they are capable of parasitizing each other. The challenge we have is that newborn kids, when they first start walking around and checking out the environment, will pick up fecal pellets and put them in their mouth. They may spit them out, they may swallow them, but they're picking up oocysts from their dams. One of the things we have to realize is prevention of coccidiosis is then going to begin at birth. A lot of times people wait until the kids start scouring or having bloody diarrhea at 3 and 4 weeks of age, and by then they've had significant scarring of the digestive tract. So it's extremely important to keep the kidding areas clean and dry. If you're kidding out on pasture, move the animals as often as you can. You don't want them repeatedly having them bed down in the same area at night so the kids are laying in a dirty area. So either clean the pens or move the goats. You want to raise water sources off the ground because a warm, wet environment really favors the replication of Coccidia in that. They don't replicate in the environment, but they survive in the environment so that they can replicate in the goat who puts them in their mouth. And you want to keep feed off ground. So when you're talking about pasturing animals, keeping feed off ground is impractical because you're grazing. So that means moving the animals frequently so they don't graze too close to the ground. And so you're seeing some lovely Coccidia oocysts. They look big and beautiful on the slide there. That's at 400 magnification. This photograph is courtesy of Fiasco Farm. The rest of the photographs you'll see in this presentation are all mine, but this is the only one I took because it's an outstanding picture of what Coccidia look like. So as a practicing veterinarian, if you bring me a fecal sample from an animal and ask me to check for Coccidia, I'm going to run it over to the D-Lab because they've got a swinging bucket centrifuge that can spin the fecal samples at a very high rate of speed. It drives those oocysts up to the top so you can get an accurate count. How many Coccidia are there? Keeping in mind that there are always going to be some, but do we have a lot of Coccidia? Is that the cause of our health problem? Or is it just the normal, well, it's got the normal amount of Coccidia? So coccidiosis in feed, coccidiostats, in feed can be used to reduce disease. A lot of us are feeding creeps that contain decox or rumensin. Got to be really careful with rumensin because it is one of those drugs where the margin of safety is really small. The amount that you give the host is just a little bit less than what kills the host and a little bit more than what kills the parasite. We want to keep the goats walking and have the parasites dying. So be more careful with rumensin than with decox. If you're using rumensin, I would encourage you to make sure that all the animals are well vaccinated against Clostridial disease, because when you start feeding rumensin, it's very easy for them to develop enterotoxemia, which would be Clostridium perfringens type C and D. I want to encourage you to work with your veterinarian to use prescription drugs in the water, milk or milk replacer. Anybody in this room use Decox M? It's marketed in a green bag for cattle. It's marketed to be added to milk. Well, that's a gray area now with the VFD. I was talking with a Zoetis representative, and he said technically it's not legal to use Decox M added to milk because milk is considered a feed. Technically, you can purchase milk replacer that already has Decox M in it, or you need to find milk replacer that has Decox L. But technically, you cannot legally buy a bag of Decox M and add it to milk. And that's something that Zoetis is working on. They are trying to make that a legal action. Some of the other things about working with coccidiosis prevention is cleanliness really counts. Keeping the kidding areas clean, keeping down fecal contamination. If you see that the water source is becoming contaminated with feces, you've got to move your water source, raise your water source, clean your water source. It's extremely important not to overcrowd or stress young stock, because those are the animals who are going to really be impacted. If the Coccidia start abrading the lining of the digestive tract, the tissue that moves in after the Coccidia goes through its reproductive life cycle will actually be scar tissue. And scar tissue has no absorptive purpose. So if you have an animal that has a severe enough case of coccidiosis, that animal will not be as nutritionally capable of digesting its food, absorbing its food, and is growing or producing in the future. It's extremely important not to mix age groups. And you might think, well, that seems a little bit weird. But one of the things that we want to do with coccidiosis is we want to have a little bit of exposure to coccidia. There's no way we're going to be able to get the coccidia out of the digestive tract of the adults. But if we can keep replication down or keep exposure down in the young animals, then they have an opportunity for their immune system to develop an immunity to the coccidia so that then their own immune system the rest of the life can keep the levels low and you won't have to depend on drugs. And where this becomes important in mixing age groups has to do of if you're kidding in waves, where there's a big wave of say 2 weeks of kids and then a couple weeks and then 2 weeks of kids, those older kids in that group are now shedding coccidia, but they are immune to them. And if you put neonates in with those older kids, they will pick up a high level of coccidia from those older kids, but they are not yet immune. So please don't mix age groups if you can at all possibly avoid it. That's just a little black Spanish goat on a bucket feeder. The first slide I showed you is in a herd of 1,250 boar and black Spanish mixed goats out on Mountain Mahogany here in Colorado. And the first year I started working with them, we had 74 bums. I went through the group and would culled those that were, either they had mastitis or I suspected they had Yanni Disease or they had abscesses or whatever. We culled the non-productive ewes, but we had 75 bums. The next year we went through, we had 56 bums. The next year we had 10 bums, and last year we had none. So going through, taking care of the animals, selecting animals, but I also worked myself out of a job because those bums were a great profit margin on the side to use the milk from my dairy goats. But good management practices make a tremendous difference in kid survival. One thing that I'm bringing this topic up at the grace of one of my clients, I have a young lady who is very irritated by what happens at fairs and at jackpot shows where she sees animals that coming in and being dropped off at the fairground and they're coated with lice. And they'll say, well, I just treated him yesterday. And we all need to realize that all goats are susceptible to lice. My clients are often surprised that I'll comment to them, you walk out through the herd, and this is the rear quarters of a young buck, and you can see these little areas on the hair where they've parted the hair, or they're scratching, or they're itching on fences, or if they're a horn goat, they're using their horns to reach back over their back and scratch. Those goats have lice. Goats are not naturally itchy animals. Their hair should lay down flat against their body. And I see lots and lots of goats with lice. Heavy infestations, goats have both sucking lice, which suck blood, and chewing lice, which live on the dandruff on the surface layer of the skin. And so heavy infestations can cause anemia. And if you have a bunch of anemic adult does and they're raising kids, milk is a product of blood flow. And if you don't have a good blood flow, you are not going to have a lot of milk. You're going to have a poor rate of grain. And the other thing, too, is they're really hard on fences. They'll break your fences down. They're scratching, they're itching, they're chewing all the time. It's a good thing to routinely examine your goats for lice. Just walk over, run your hand the wrong direction, or look in the low-haired parts. I once took a group of veterinarians from Czechoslovakia around to my clients, and this one guy had on a white shirt. We stopped at this boar operation, and he loved this one little kid. He was carrying the kid around for about 10 minutes. He put the kid down, and we saw lots of little 2 mil light brown tan lice all over his white shirt. So I've remembered that, and there are occasional times when I can't find lice, and I'll just put a white cloth or a white towel over the back of a goat and check it a few minutes later, and yeah, it's got lice. It's extremely important to treat topically with D-lice twice, 2 weeks apart. So showing up at the jackpot show or at the county fair, treating the goats the day before the fair is not going to kill the lice. It takes about 2 weeks. You want to treat them twice, 2 weeks apart, so that the lice that have been killed with the first throw have already laid eggs, and you don't want them to hatch and make more. And the second treatment should be at least 2 weeks prior to a show, because it takes at least 2 weeks to kill all the lice. In 2012, the national show was here in Colorado. We had 2,289 goats up at the fairgrounds in Larimer County. And there were a few herds that were quarantined at that show and had to be treated for lice and were kept in quarantine while they were there because they arrived on the fairgrounds and their compatriots were not thrilled. You know, I told you we'd jump around. We're going to zip over to nutrition. One of my other favorite comments to make is that all nutrition is local. And so the soils we have here in Colorado are different from the soils they have in Kansas or Texas or Oklahoma. So the recommendations I make to my clients here in Colorado apply well to our intermountain soils and the feeds that are grown on those intermountain soils. So if you're buying feed that's put up in a different state, you don't really care so much about what is in the soil in the state you live in as you care about what is in the soil micronutrient-wise in the state where the hay or the grains were made. And within a state, for example, California is absolutely huge. California has wide extremes in the amount of copper in the soil. So in some parts of the state, they have copper deficiency. In other parts of the state, they have copper toxicity. I do not know enough about the variance. I realize that Texas is a very large state, but I don't know enough about the mineral nutrition there to know if you have the extremes that they see in California. The reason that I harp on this so much is that no one trace mineral product is safe for all areas. What they might do in the southern United States where it's hot and humid and warm and copper deficient and they can get away with feeding copper wire oxide particles to prevent parasitism, you can't do that in Colorado. I can guarantee you give a Coccidia bolus to a goat in this state and you're going to kill it. So keep in mind that both copper toxicity and copper deficiency occur. And so the trace mineral that you choose to use and make available for your animals needs to be correlated to the amount of copper in the diet in the area in which you use. So on the left here we have a close-up picture of what's inside the little Coccidia boluses, the copper oxide wire particles. You'll see them listed in the lay magazines as COWP. And on the right, we have a Saanen goat that was given a copper bolus, and you can see how orange those eyelids are. The cool thing are the sclera, the whites of the eye are. The cool thing about goats compared to sheep is that goats can tolerate a higher copper level than sheep can. That animal on the right, had that been getting a Coccidia bolus, would probably be dead if it were a ewe. They just don't tolerate copper the way goats do. Keeping on that theme that all nutrition is local, it's really important that you analyze your feed to make sure you can balance the diet. You know, a lot of times when I go and meet a client the first time, they'll tell me about their feeding program, they'll tell me why they feed, where they get their feed, and whatever, and the answer is usually, well, this is the way we've always done it, or this is the way my grandfather taught us to use it. And those are not bad things. It's just that we should look at the whole program and make sure that what we're doing makes sense. Calcium-phosphorus ratio should be in the neighborhood of 2 to 1. And where we start getting into things with urinary calculi are when that calcium-phosphorus ratio gets way out of whack. Excessive minerals, either through trace minerals or through minerals in the water, minerals in the feeds we feed, if we have excessive minerals in the wrong balance, then we're going to see urinary calculi problems. You want to encourage water consumption throughout the year to prevent urinary stones. And it's extremely important because if you look at any feed bag marketed for meat goats in the country, it's going to say something on there about ammonium chloride and what the ammonium chloride content is. It's important to remember that only stones dissolved in acid, primarily struvite, are going to respond to administration of ammonium chloride. So on the left, my favorite way of diagnosing urinary calculi is with ultrasound. We have a nice giant full bladder there on a goat who was very much plugged. Does this thing have a pointer?
Yes. Let me turn it on first.
And let's see, off, on, there we go. Ooh, it's beeping at me. So we have, this is where the transducer is on this goat. Sound waves are coming out like this. This giant black hole is the full bladder, and I mean, that is a really full bladder. This guy was looking for a bathroom 2 days ago. And this sludge here, these white speckles, are all urinary stones. And this was the classic situation that we have here on the right. These are your classic calcium carbonate beads, also called gold beads. I've seen goats that have had literally thousands of those in their bladder. And unfortunately, no amount of ammonium chloride is going to take care of that problem. So if you do run into a situation where urinary stones are a problem in your herd, I would encourage you to have the stones tested to find out what the makeup is so you can figure out where the source of those excessive minerals were. Continuing on with the idea that all nutrition is local, selenium and vitamin E are both essential for many different functions in our bodies, predominantly growth, reproduction, immune function, and prevention of white muscle disease. You'll hear them talking about white muscle disease like crazy over in the sheep sessions. We don't see as much white muscle or selenium deficiency in goats as they do with sheep. Maybe goats are better scavengers of selenium. So when you have low soil selenium, you'll lead to selenium deficiency, either as evidenced by poor reproduction, poor immune function, or muscles that are not properly formed and never will grow to be nice, normal, healthy muscle. Green forage in the diet is our important source of vitamin E. So sometimes late winter, early spring, before the grass grows up, you're using old feeds. Vitamin E, being a fat-soluble vitamin, doesn't last long in the diet. So we're going to be looking for sources of vitamin E. If you look at the feed labels on your feed, you'll quite often see there's vitamin A, D, and E supplementation. Those are fat-soluble vitamins that don't last a long time, and that's why they're in the diet that way. But it's really important to consider daily supplementation and feed over periodic injections. I remember when I first graduated, we hear about, well, what's the difference between Mu-C and Bo-C? Mu-C was spelled M-U-S-E, Bo-C is B-O-S-E. Mu-C is about 10 times as potent as Bo-C. I'm not sure it's even still on the market at this time because you can actually kill animals with it. So Bo-C is, you'll find it in feed stores available over the counter. And if you look at this map of the United States, it'll show you that in the West Coast, these areas that are kind of foggy gray right here, not hatch marked, are areas that are low in selenium in the soil. The hatch marks are areas that are just exquisitely low in selenium. And then we have here what we call the Great American Desert, the central states, and we have lots of selenium in our soil. So the last thing I want my clients to do here in Colorado, or if I lived in Texas, would be to give selenium injections to their sheep or their goats, because you can actually cause selenium toxicity instead of deficiency. Vitamin E deficiency is uncommon. I only see a few cases every year, but it does respond well to injections of affected animals when it shows up. I guess the next logical thing after we talk about nutrition is body condition scoring. And body condition scoring is not looking at an animal and saying, oh, I think she looks good, she's ready to go into the show tomorrow. Body condition scoring is where you actually go out amongst the animals, you walk through them when they're calm, quiet, and you accurately assess the condition of their body by palpating along the dorsal processes of the back, across the sternum in the chest, and then between the individual ribs. And both excessive condition, too fat, like I could use a few calories less, and inadequate body condition, like my 27-year-old daughter, predispose animals to poor health. And this is true across all species. Your veterinarians are telling you to put your dog on a diet, your cat's too fat. We more often hear those things than they're too thin. But in goats, we tend to see the extremes. I tend to see animals that are either too thin or too fat. And we're going to get into health problems at both of those extremes. Inadequate condition is going to slow the growth of the animal. If it's a milking mom, she's not going to produce as much milk, which means her offspring are not going to grow as well. It'll impair their immune function. Immune function consumes lots of calories. I recently had an opportunity to see a goat that was unexpectedly high in its parasite count. And we were really surprised until she died quite unexpectedly, and we found a huge tumor in her chest that was a thymus gland tumor. The thymus is one of the important components of the immune system. So the reason that that goat had a high fecal egg count, you'd be thinking parasites, actually was because she had a giant tumor destroying her thymus gland. Anytime you have an animal in inappropriate body condition, it also increases disease susceptibility. And if we're talking too thin an animal or too fat an animal happens to be pregnant, we're going to get pregnancy toxemia. The Nubian doe that you see on the screen here, you can see how the dorsal processes of the individual vertebrae stick up, and then she's got a real sharp loss of muscle mass over the spine. This is the transverse processes of the spine of the individual vertebrae. Unfortunately, the lighting on this, no matter what angle I tried to take it, you could actually see ribs. There is no time you should ever see ribs on a sheep or a goat. If you can see ribs on a sheep or a goat, they are either really sick or they're underfed. And then you can see that she's barely got any muscle mass over her rump, and she's got a real small abdomen. If the lighting were not quite so bright in here, we could see she's got a really dull hair coat as well. And that is basically what some people call agroceriosis, i.e. not being fed. When you think about body condition scoring, it's a routine assessment with a correction of the diet to prevent many health problems. I was called to see this boar buck, and you notice he's down. He's down and cannot rise. You can see his spine as you could in those others. You can see his ribs. Look at that paralumbar fossa that's just sunken in. I could actually take my hands on both sides of his abdomen and touch my fingers together. You don't see boars that don't have abdominal fat. This guy had a chronic health problem. He could not rise unassisted. I ended up euthanizing him that day, and he had Yanni's disease. So it wasn't a lack of nutrition, it was a disease process. But it's extremely important to body condition your animals to find out which animals are having problems so that we can correct those problems. You want to check your body condition score prior to breeding. Anytime you're moving livestock, I'm moving them from this pasture to that pasture, I'm taking them from this state to that state. Prior to parturition, it's real easy to look at that big belly on a doe and assume she's in good condition. What if she's got triplets in there and she's a thin shell around those triplets? She's not going to make milk for them. And then at weaning, too often we look at a pen of kids, we don't see the individual kids. Look for those thin kids. Look for the over-fat kids. The over-fat kids are going to get into bone problems with development and abnormal leg angulation because they ate too much too fast. You want to maintain a body condition score of 2.5 to 3 on a scale of 5. I know in horses they use 0 to 9, but most of our production species, cattle, dairy cattle, beef cattle, dairy cattle, swine, and goats, and sheep, we use a scale of 5. And if you do not have a good reference that teaches you how to body condition score, and I know that Betty Henning showed this morning some really nice photos of goats. The Illustrated Standard of the Dairy Goats got some nice pictures in it. But this website from Luristext, which is Langston University in Oklahoma, has got both videos and verbal descriptions on how to body condition score. So if this is not something you're familiar with, it's a great teaching tool. Betty?
Also, we have a body condition scoring video that we did at UC Davis.
Right. Betty just mentioned that she and Joan Dean Rao made a really nice video. I forgot, and I apologize. I did forget. I wasn't thinking about dairy goats. I was thinking meat, meat, meat. But the American Dairy Goat Association website does have a really nice video on body condition scoring. It's a little bit longer than the ones from Langston, and I think the one that's on here talks a little bit more about muscle structure and why you're looking when you're looking. I've seen your video. It's a good video, but I think this is a good companion to it. So we're going to get on another my favorite topics is testing for chronic infectious disease. And I doubt if in the big herds you're doing too much screening for these diseases, but in the smaller herds, particularly people selling seed stock or in the dairy goat industry, we get people wanting you to test for CAE, Yanni's disease, and CL. They want every animal tested, and they're asking for all sorts of things that I as a veterinarian can't provide. So the diseases that we are worried about that can sneak into a herd and cause either loss of function of the herd over time, loss of productivity, or early culling would be caprine arthritis encephalitis, commonly called CAE, Yanni's disease. Notice it's Yanni's. It's not John's disease or Johnny's disease. It's named after the German microbiologist who discovered the organism that caused the disease, and Casey's lymphadenitis or infection with Corynebacterium pseudo-TB. They are chronic, they're lifelong, there is no treatment. You cannot eliminate the causative agent, and the animal will never return to its non-infectious state. So yes, it's important for us to get these diseases out of our herds, but we can't just test our way out of it. Animals with these diseases are infectious to the other animals in the herd. If you have one infected animal in the herd, over time they will all become infected. There's a really good research project from National Veterinary Services Laboratory that lasted over 13 years, and in that project they tested over 16,000 goats for caprine arthritis encephalitis virus. And in a herd, what they did is they did whole herd testing. So if you started the project, you had to test every animal in your herd that year. The next year you tested every animal. And after about 3 years, they could see how it was developing in some herds. So if you participated in their prevention program, they would continue to provide you with free whole herd testing every year. And what they discovered is over a period of 4 years, if you started out with a single positive animal in the herd, by 4 years into the program, the entire herd would be positive for caprine arthritis encephalitis. And because it is a loss of production disease and a decreasing longevity disease, the animals don't live very long, they've developed very effective prevention programs against the disease. Effective testing programs will combine good management practices with testing. So the purpose is to lower the incidence of the disease. You cannot just walk in and test animals. You need to break the methods of transmission. And I want to encourage you, if you decide to use any of these tests in your animals, to use only laboratories that are certified by the American Association of Veterinary Laboratory Diagnosticians. I'm not a member of that association. I make no money telling you this. They don't pay me a fee. But the thing that's important to realize, especially like with CAE, a private individual can currently go out on the market, buy CAE test kits, run the test kits themselves, and yet they've not been trained at what they're doing. They don't know how to read the weird results you might get. And I want to make sure that anybody who's spending the money for testing gets results that are benefit to them. USDA has licensed and validated 2 different tests for detection of antibodies to the CAE virus. One is a colorimetric test. It's called a C-ELISA test. It's the one, if you're used to talking to goat people, they'll talk about WADDL, W-A-D-D-L, the Washington Animal Diagnostic Disease Laboratory. And they run the C-ELISA as well as the California Animal Health Food Safety Laboratory at Davis. It's a colorimetric test. So you or I looking at this plate on the left, with all these little wells that have different shades of yellow, I can't tell you which of those are more yellow than what. There's a test that uses a blue colorimetric and there's one that uses yellow. And to me, yeah, I can say that that one over there is pretty darn yellow, but how much more yellow is it than this? So a C-ELISA test has to be run in a laboratory that can use a reader that will actually determine how much antibody is there. The other test that's licensed and approved is a visual test. It's the Agar-gel immunodiffusion test that you can actually see the antibodies. So this animal is test negative, this animal's positive, this animal is positive, that animal's positive, and then these 2 are kind of wishy-washy. They would probably run those a second time on their own plate without any other samples being tested. So the 2 tests are both licensed and labeled. They can be used in different ways in screening programs, but those are the only 2 tests to use for caprine arthritis encephalitis. Caseous lymphadenitis, or infectious abscesses that spread from animal to animal. It's well documented that in multiple large-scale research projects, the only accurate diagnosis for caseous lymphadenitis is through culture of abscess contents. I get calls from clients all the time, oh, I've got this great big abscess, it's CL. You can't look at an abscess and know what's causing it. And so the thing you need to do is clean it up, prep it, do a sterile, have a veterinarian, or if you're bold, do it yourself. And then take a clean aspirate, submit it for culture. And then if it comes back as Corynebacterium pseudotuberculosis, the causative agent of caseous lymphadenitis, then you have some decisions to make on what you're going to do next. Both WADDL and the California Animal Health Food Safety Laboratory offer a test called the Synergistic Hemolysin Inhibition Test, or SHI test. And it's a test developed to identify antibodies to the exotoxin produced by this bacteria. The challenge is there's more than one bacteria that produces that exotoxin. And so you might get back a positive SHI test, be all worried about having caseous lymphadenitis, and it's not really that particular bacteria. There are some common gut bacteria who also produce that exotoxin. And so on the Wattle website, and I know people who are always asking me to bleed their animals for this, I was looking this at yesterday, is what do they say about interpretation of this test? So the quote at the bottom, no CL serologic test is sufficiently reliable to confidently detect infection in an individual animal. And I have people coming to me as a veterinarian saying, well, I want to take my doe over and breed it to that buck. They want CAE, CL, and Yonis. I am more than willing to run the CAE tests. Those are specific, they are sensitive, they're well validated, but the SHI test is not. It's not specific, it's not sensitive, and it's not well validated. So I discourage people, if you think you've got an abscess, then see your veterinarian or learn how to sample the animals so you could submit them for culture. We're not talking about what to do if, we're only talking about what's available. The last particular of these chronic infectious diseases that I worry about is Yanni disease. It's a chronic, very slowly developing disease of the digestive tract. Ruminants do not produce sufficient serum antibodies until very late in the course of disease. In dairy cattle, this usually means by their third year or fourth year of their life, they'll start producing antibodies. In goat years, that means they've kidded 3 times before they're going to start showing that they actually have the disease. Infected animals may never develop demonstrable antibodies until years after the infection has invaded the digestive tract. And both fecal culture and PCR from pooled samples can demonstrate whether or not the bacteria is present in the herd. So I do a lot of environmental sampling for Yanni's disease in herds that don't know whether or not they have a problem. I pull soil samples from near their water devices, soil samples for underneath the feeder. If they've got a bedding area where the does like to lay at night and there's a nice big poop pile there, that's a great place to do environmental testing. And I would rather determine whether or not the herd has a disease than get negative test after negative test after negative on individuals. To me, a negative test for Yanni's disease is not necessarily diagnostic. It doesn't tell us whether or not the disease is present. A Yanni's test on the environment tells me whether or not the disease is in the herd, and I don't have a good test to tell on an individual animal. And we've got this is just a loop of ileum from an infected goat, and you can see how, those of you who've seen normal goat guts, you can read newsprint through it. It's a nice, shiny, firm tube, and you can see these wrinkles, these corrugations. And then this is what the lymph nodes look like. They're 10 to 20 times their normal size. And that's because they have infiltrate because of the disease. I would like to add to a comment about routine management practices to some of the comments made this morning about Scrapy ID. One of the biggest challenges I have as a veterinarian is dealing with clients who don't know about Scrapy ID. It's hard to believe that a program started in 2001 and we still have an awful lot of herds out there who've never heard of Scrapy identification. So all goats are required to have permanent unique individual animal ID when they leave the premise of origin or if they change ownership. If you want animals to be traveling on a certificate of veterinary inspection, all goats must be listed individually by their unique ID. Most states accept the USDA Scrapy tags, and registered goats may be used their tattoo with registration papers. A tattoo without registration papers is not unique ID, and the registration papers must travel with the animal, whether it's going 2 blocks down the road or to a different state. Some states will allow more liberal definition, but Colorado has had cases of Scrapy. If you remember the slide that Dr. Sutton put up, there have been 5 cases of Scrapy confirmed in this state. It's very important that you know what your state regulations are, and if you're going to travel with animals from one state to another state, you need to read their Scrapy regulations carefully because there are some differences. In Colorado, all goats have to have ID regardless of the purpose of the animal. So animals that would be considered low-risk commercial animals in another state are not low-risk commercial in Colorado. All sheep or goats over 18 months of age leaving the premise of origin outside the slaughter channels must have ID. The thing I try and tell my clients is it's so important for them to know which animal's which. that the easiest thing, the best thing that's happened to sheep and goats since February 2001 is the implementation of the Scrapy identification program. It gives validity to your records. It allows you to assess what's going on in your flocks. So for many reasons, I encourage you to use ID. I want you to provide clean water at all times. For those of you who might not be from Colorado, ice does not count as water. You'd be surprised how many times I go out on a farm to see a sick animal and every bucket in sight is full of ice. Creeks full of ice, rivers full of ice in the winter. Where in the hell are they supposed to get it when the irrigation ditches are dry? So ice, empty irrigation ditches, frozen rivers don't count as water. I really like white water containers. I go to farm after farm where you see black bucket after black bucket. You can see that the water's clean. Yanni's disease, the bacteria that causes Yanni's disease, Mycobacterium paratuberculosis, lives in the biofilm in watering devices. So if you have one animal on the farm who's got Yanni's disease and you are using buckets that are not cleaned on a routine basis, water containers that are not cleaned, free-flowing ponds with animals pooping in them, you can actually have Mycobacterium in your water supply. And then I particularly like this one. This is on a commercial goat dairy here in Colorado. They've just put something simple like chipboard underneath their waterer so that water spilling over the edge is not making a moist environment where Coccidia can survive. You can see that this is a light-colored water trough, so you can see it's clean, it's not green. And then they've put the 4-inch by 4-inch, what I call cattle panel around it, so the animals can't get in it, they can't poop in it. And it just keeps the water really clean. It's a small commercial dairy, and it's doing a really good job at providing clean water. So many things. Milk is a filtrate of water and blood, and if you can't have water flow, you won't have milk. Routine foot trimming. I can't tell you the number of times I get called out to see a lame boar doe or a doe right after kidding whose feet are just in horrible condition. Routine foot trimming will prevent hoof cracks, sole abscesses, and excessive strain on the tendons. I feel really sorry for these big show does, 200, 250-pound does. They've got 4 kids in there. They're carrying an extra 80 pounds body weight, and their dew claws are almost on the ground because nobody's bothered to trim their feet. Those animals will be able to walk farther, eat more, and be more productive if they can walk, so trim those feet. I have Sonans, your basic white goat. They come in white, sometimes they're white. They have white claws, and I will tell you it is so much easier to trim white claws than black claws. But the advantage of black claws is they grow a hell of a lot slower and you don't have to trim them as often. And it's another important thing that I see as a veterinary perspective is that you cannot correct conformational faults through hoof trimming. So many times somebody will bring me a goat and they'll say, well, you know, I tried fixing her feet. Her problem wasn't her feet, her problem was in her bone structure, and you will not fix that with hoof trimming. You want to make sure and provide adequate shelter appropriate for the climate, for the number of animals that you're going to house together. You want to separate animals by age and condition. If you're running young kids in with your mature does, those young kids are not going to get enough calories, they're not going to get enough protein, they won't grow well. And likewise, if you got ancient goats in the herd, and to me ancient is the 14, 15, and 16-year-olds that yes, I do see in production. I heard earlier people were talking about, well, in commercial production, they're gone by 6. A lot of that has to depend on where they are, what they're ranging on, what their food source is. But Dr. Rao, whose name has been mentioned earlier today, would be horrified to think that she'd be culling her does before they died. You want to make sure that keep them out of the wind and the wet. You don't need fancy barns. You don't need enclosed areas. You just need to figure out how you can keep them dry and out of the wind. Goats are really good at temperature ranges. They just don't like wind and wet. And then ventilation is extremely important, especially in those people who house them inside in the winter. You'll get, unless you have some sort of planned ventilation, you're going to have problems with ammonia building up and causing respiratory disease. This is a commercial barn in Ohio. It's taken in the winter. You'll notice the pens are clean and dry. The goats can go in and out, a huge open door. You can see that they lower these wooden panels down to increase ventilation. They got fans in the top. When I was cutting this slide down to use it for today, there are actually really nice fluorescent lights in the ceiling, so the lighting is fantastic. And then we have these 2 little Nubian bucks over here I felt so sorry for. Their pen was actually 4 feet by 6 feet, and that was their entire life. And so I really believe in adequate environment for your animals. Last slide, don't panic. Genetic selection. Boar breeders in my area are tired of hearing me talk about teats. But if you're raising animals that are supposed to nurse and are going to get their first 8 to 12 weeks of nutrition off that udder, you better have teats they can milk. And so we have a picture over here. Hello, I pushed the wrong button. We have a picture over here with your basic supernumerary teat. Imagine you're a triplet coming into this world, and you've got 2 bigger siblings, and the 2 bigger siblings are grabbing the 1 teat on each side of the udder, and you're stuck with that. You're the kid who's going to starve to death and be found dead on day 2 because you never found a milk source. Goats are just terrible about, this is my teat, go away, you can't touch it. And they won't share well. And so I am not a fan of having supernumerary teats. We have proven in the dairy goat industry that selective breeding, you can get rid of teat defects. This one, unfortunately, in this lighting doesn't show up as well. This is what would be called a fishtail teat in the boar breed, in which you have a double fused teat, and I've got the perfect fingers for this. The ends of my fingers diverge. So on these double fused teats, you have what looks like one very fat teat. The teat ends separate, and for the kid to be able to nurse milk out of that, they have to put that whole huge teat in their mouth at the same time. And you see some of these Bordeauxs with these big udders, and they're hanging down low, and then they've got these huge teats, and then they wonder why their kids die. And then we see entropion. I see entropion in Nubians and boars. So this is the eye on a 2-day-old Nubian. The lower lid is actually rolled inward against the eye so that the eyelashes are scraping the lid every time scraping the cornea every time that eye opens and closes. And it's caused this lovely pigmented ulcer down here. It can be corrected, but the best correction is genetic. Figure out who the parents are and get rid of those genes. And then the last thing that I commonly see is both parrot mouth, where one jaw is not the same side, where the mandible and the maxilla do not meet sharp on. And so you might have a maxilla that protrudes and a mandible that's shorter, or you might have the other condition where the maxilla is here and the lower jaw extends past it. We see that as a problem in the front of the mouth. What we don't realize, it's also a problem in the back of the mouth where the molars are not rubbing against each other and wearing each other off. And then this kid has a cleft palate. And I have not yet seen a cleft palate in a boar or a Kiko, but I've seen them in almost all of our other breeds. Now, most of the times the cleft palates will wean themselves out. Occasionally I've seen, because they don't survive to reproduction age, occasionally I've seen an animal with a little hole way back in the back of their palate, and those animals will actually get along okay if they're fed. So please be aware that there are genetic abnormalities in goats in addition to G6S that are genetic traits, and it is important for us to select against those. Any questions? Not one question. Well, thank you all very much for your time. Did I miss a question?
The American Goat Federation, AGF, is a nonprofit national association that represents the interests of more than 200 organizations and thousands of producers engaged in the sustainable production and marketing of goat milk, meat, fiber, and grazing services across the United States. This video was produced as part of the educational services of AGF. AGF also supports research projects that will benefit the goat industry by writing letters to accompany grant requests and providing information when requested. The board of directors is made up of representatives of member organizations, individual producers, and industry specialists from all parts of the United States. Director candidates are nominated and serve 3-year terms on the board. AGF is headquartered in West Lafayette, Indiana, and open from 11 a.m. to 4 p.m. Eastern Time, Monday through Friday. Visit our website, AmericanGoatFederation.org, where you will find information about goat management, healthcare, and other resources. While you're on the website, become a member of AGF and help us provide information to goat owners and represent all goat producers by providing information about our concerns and industry needs to government agencies, USDA, and researchers.